what I'm hitting on right here, and the reason that I kind of want us to look at this now is because when we get in part 2 into the endocrine system, this information about the calcium homeostasis, it is definitely going to be coming back to us. And what I'm hoping that you'll be able to do is put together this information about the buildup and the breakdown of bone, and one of the reasons is for us to be maintaining calcium levels within the blood, because that's what it's going to all come down to. It's going to come down to the primitive region in our brains monitoring the calcium levels in our blood and then releasing these hormones from certain areas of the body to either make us build up bone or break it down. So the calcium homeostasis is extremely important in our body, because when I say that maintaining calcium levels in the blood, the body will only allow a very small fluctuation. I mean extremely small fluctuation. So the way that we are going to be able to manage the calcium that's in the blood from our endocrine system, is everybody familiar with the parathyroids? The little glands that are on the back of the thyroid, all right? The parathyroid glands, they are going to respond, now look what they respond to, a decrease in the calcium levels. So that part of the endocrine system, it's checking for a decrease. So if we get a decreased level of calcium in the blood, the parathyroid glands are going to secrete their product. If we have a decrease in blood calcium, what do we need to do? Do we need more calcium in the diet? Do we need more calcium in the blood? Do we need to be storing it in the bones? What is it that we need to be doing if the levels are not high enough in the blood? We need to get more, all right? So let's think about this for a second. We take in our foodstuffs, is that correct? So if we're taking in our foodstuffs, this means we're affecting absorption in the stomach, in the intestines, okay? Because we want to increase that vitamin D, that calcium in the blood. Now, the kidneys, wait a minute, huh? What? I've now told you, endocrine system. Now I keep telling you, urinary system, digestive system, vascular system. Wow, wait a minute, hold up, time out. What bells are ringing about your skeletal system right now? Please tell me that there are some bells ringing about the skeletal system for you. Hopefully, it's not just for structure. All right? Hopefully, it's giving you an idea that this system is going to affect every other system of your body. When I say every other system of your body. I am telling you, it's affecting the urinary, it's affecting the digestive, it's affecting the muscular, it's affecting the nervous, it's affecting the respiratory, it's affecting the cardiovascular. When I tell you it's affecting every other system of your body, I'm not joking. Your skeletal system does this. Is that just not amazing? I mean, think about that.
Is that where your overall health is?
Your overall health, like meaning if something is like wrong or, oh, the oral health, yes, most definitely. Because, I'll give you a little preview into that because it really is cool, all right, about your teeth, okay? When we think about our teeth, we think about calcium, right? Which is the same thing that we're thinking about with bone, right? Now here's the kicker, okay? Yes, calcium for the teeth, but teeth sit in the sockets, which we know this, okay? And then there are ligaments that hold them in. And if you ever see the ligaments that hold the teeth in place, oh, that is so cool. Okay? And I mean, those ligaments start to break down, i.e. periodontal disease. Okay? You see the teeth get loose. Okay? Now, if we think about this calcium homeostasis, the calcium homeostasis not only affecting the teeth overall, but what is another component of our skeletal system? Tendons, ligaments, cartilage. So yes, is that not cool? Trust me, it's cool. Okay? So, here we go. The parathyroid hormone from these parathyroids. Parathyroid hormone will get released. Now, it'll get released if calcium levels are low. So parathyroid hormone, watch what it does. It will go and act on the bone. Notice what it stimulates. It stimulates osteoclast. If we stimulate the osteoclast, we're going to break the bone down. If we break the bone down, that means we're putting calcium back into the bloodstream, and therefore we can raise the levels of calcium that can be detected. The other thing that the parathyroid hormone is going to do, the parathyroid hormone is going to act on the kidneys. The kidneys will decrease their uptake of calcium, allowing it to return back to the bloodstream. They'll also help with the vitamin D production, vitamin D use, which will play a part on the intestines, which will tell us to increase absorption of calcium from our foodstuffs. So the parathyroid hormone is doing everything it can to help bring those levels of the calcium back up in the blood. Now, let me check this one. Can I have an increase in calcium levels in the blood? Yes. Okay. Now, under normal circumstances, hopefully it would get stored in the bone, maybe even in the teeth, make teeth healthier. Okay. But sometimes if there's too much calcium in the blood, it'll get stored in soft tissues. Therefore, making, like hardening of the arteries and organs getting, stones in them and that sort of thing. Now, in the case of where we're going to have an increase in blood calcium, look what happens with the thyroid gland. The thyroid gland stimulates calcitonin. So calcitonin is saying, or picking up that we've got too much calcium in the blood, and what does it want to do? It wants to stop the osteoclast and let the calcium get laid back down into the bone. So the body uses the skeletal system to balance out this homeostasis. Overall goal, keeping that calcium level within the acceptable ranges in the blood. Now the last thing to finish up with this chapter, bone fractures, the types. We can have an open fracture, also known as compound. This is where the bone breaks through the skin. If it's closed, the skin does not get perforated, and you'll see them listed in this way. Incomplete means the break doesn't go all the way across the bone. If it's a complete break, it has went all the way across. The types, you've probably heard of some of these: green stick, hairline, commuted, okay? Well, this is going to be an indicator of the types of breaks, okay? If it's a hairline, that's sort of what it looks like. It looks like you got a hairline in the break. Green stick, that's going to say, okay, well, it happens at a curve of the bone. Commuted, more than 2 places got broken. The bone's in more than 2 pieces. So as you look at the types of fractures that we can have, impacted, one bone pushes into another bone. Sometimes they're classified on what is the direction of the fracture. Is it in a direct line, linear? Is it transverse? Is it like just going directly across? Is it spiral or across through the bone? Is it oblique? Does it look like teeth, meaning dentate, having little rough pieces across it? Is it radiating from a central point? These are all the types of terms that you would see with a bone fracture. This is what some of them look like. More than 1 piece, in a direct line, all the way across the bone, not all the way across the bone, directly straight through, one bone pushing into another, spiral, wrapping around the bone, oblique, at an angle through the bone. These would be little representations of the types of breaks that you might see in bones. This is showing a fractured epiphyseal plate.
Can all of those types of fractures actually occur or happen in one bone? Like all different types?
Like
For instance, like a, I don't know, like a...
Could you have an oblique, transverse, spiral, and green stick all at the same time? I got a feeling if that's the case, chances are the break is so bad they're not even identifying all the different types. So, as we were talking about, I think earlier in the chapter, if you get a fractured epiphyseal plate, you're definitely going to want to make sure that you get a good pediatric orthopedic doctor, because you don't want that epiphyseal plate not healing correctly. Yeah, we're good, because I'm getting ready to finish up. All right, so what are the effects? As we age, the bone matrix decreases. We definitely get a lack of collagen. Also, our hydroxyapatite decreases. Our bone mass decreases. It's highest around the age of 30. That's why I was saying make sure, take care of it early. Men definitely have a denser bone mass than women because they've got the testosterone, okay? African Americans and Hispanics have higher bone masses than Caucasians and Asians. The rate of bone loss increases 10-fold after menopause. This is why they stress so much to females taking care of your bones. We lose the spongy bone first, which is what's giving the compact bone the strength. Once that's lost, that makes the compact weaker, therefore more prone to fractures, osteoporosis, all those different things that can go wrong. We do have an increase in bone fractures because of all of this that's taking place. We see that the bone loss, we get loss of height, definitely get the pain, stiffness, deformities begin to show up. For example, a stooped posture, that we might see in older people. Used to be that this was really geared towards women, but they're also saying now it's just as important in the men as it is for the women to pay attention to their bones. And then, of course, the loss of teeth can occur. So you gotta love our skeletal system. Trust me, it's an awesome system. These are diseases and disorders that can come along and affect the system. Biggest one, it's probably osteoporosis that we're very familiar with. And then you may be told you've got some osteomalacia, softening. They've got lots of medications now that they can try to help with the treatment of that. And then some of them that are genetic related. So I think that officially ends chapter 7. I will see y'all tomorrow.